was a college professor here in Buffalo, working at one of the ERs, and while he was giving a lecture, he had chest pain. Now, during the lecture, when he started having this, the students kind of noticed, hey, he doesn't look good. He finally said, I'm having chest pain. They called 911. Now, the ambulance came and picked him up, and as all good EMS folk do, as soon as they come in with someone with chest pain, they have a series of things that they do. If you ever worked on an ambulance, you know it's O2 IV monitor, O2 IV monitor, O2 IV monitor. That's actually more important than vital signs, okay? Because if the vital signs are off, you really can't address them without O2 IV monitor. Now, when paramedics start their IV, they draw blood. So when they brought him into the ED, they gave the bloods over to the nursing staff. They were labeled, and they went to the lab. So an EKG was done, and I pick up the chart. So I go and see this guy. He's feeling comfortable. Said his pain was 8 out of 10, lasted about 25 minutes. At this point, he's about an hour and 15 minutes out. I look at the EKG. I leave the room, and the labs come back. Now, where I worked, we could do a panel that gave you 3 different enzymes, troponin, CK, with the MB, and the myoglobin. So when his first set of enzymes came back, they were negative. I have a non-specific EKG and a guy with, he was a smoker with cholesterol. So he had some risk factors, never had coronary artery disease. His pain at this time was relatively gone, okay? Now, what do you do with a non-specific EKG, negative cardiac enzymes? And we're about an hour and a half out at this point. What do you do? That's my scenario. So how do you work this guy up? What makes you say, yes, I can clear him from the ER? What makes you say I got to admit him? What makes you say, maybe we just need to obs him? That's a really important question, and what should you do right now?